Hello everyone, welcome back to my channel. This is actually a continuation of the anatomy quick recap series, and one of the topics seen in embryology apart from the development is the antenatal screening. What are the investigations you do in order to detect some of the anomalies? This can be asked in gynecology, pediatrics as well. So this is especially for the entrance examinations, and sometimes it can be asked as a short note for undergraduates as well. So let's see. We know the fetal period is from 9th week till birth, and the estimation of fetal age is usually done by measuring the crown rump length, which is usually taken in the first trimester, and you have the crown heel length. Now coming to the basic measurements which we see, one is the biparietal diameter of the head between the two parietal eminences. Then you look for the head circumference, then you look for the abdominal circumference, then the femur length, then the foot length, which correlates with the crown rump length, and of course the weight. Now coming to the maternal serum screening, which are the investigations which you usually do in maternal blood. The first one is serum alpha fetoprotein. It is usually produced by the fetal liver by 14th week. And what happens is this will reach the maternal circulation through the placenta, and you can test for the level of the serum alpha fetoprotein from the maternal blood. So why you have to do this in investigation? So serum alpha fetoprotein is decreased in neural tube defects, omphalocele, Down syndrome, intestinal atresia. The answer is Down syndrome. So if you get a decreased level of serum alpha fetoprotein, then that condition is known as Down syndrome. And where will you get increased? So the options are sacrococcygeal teratoma, omphalocele, gastroschisis, trisomy 18. So in 3 conditions it is increased except. So which is the exception? Except in trisomy 18, all the other conditions have increased serum alpha fetoprotein. So this is again a very useful chart so that you can pick the answer very easily. Serum alpha fetoprotein is increased in neural tube defects, sacrococcygeal teratoma, abdominal wall defects, omphalocele, gastroschisis, bladder extrophy. Then if there is an amniotic band syndrome, then intestinal atresia. So you can see that the neural tube defects, sacrococcygeal teratoma, then almost all the rest are abdominal conditions. So in all these conditions you have a raised level of alpha fetoprotein. But where will you get a decreased level of alpha fetoprotein? It is seen in Down syndrome, trisomy 18, triploidy, 6 chromosomal anomalies. So the things dealing with the chromosome, those conditions are having a decreased level of alpha fetoprotein. Now, have you heard about triple test or Kettering test or BART test? Usually done during the 2nd trimester, that is from 15th to 18th week. So what is the main idea behind doing this test? It is to detect the chromosomal abnormalities and neural tube defects. Which are the things which you look for in the triple test? You look for the alpha fetoprotein, you look for the unconjugated estriol, and also the beta HCG. Suppose you have a condition known as trisomy 18, Edward syndrome. All these 3 will be low. But what about Down syndrome? In Down syndrome, except for beta HCG, the remaining will be low. Okay, beta HCG will be raised. So some conditions like this, if you remember, you can very easily crack the MCQs. So let's see. In triple test, Down syndrome gives the following results. You have the HCG increased, whereas alpha fetoprotein and unconjugated estriol decreased. And what do you mean by quadruple test or quad test? If you do a test of inhibin A along with the triple test, you call it as quadruple test or quad test. In this condition, if you test inhibin A, in Down syndrome it is increased, whereas in Edward syndrome it is decreased. So that is the clue which you get. Now quadruple test for Edward syndrome shows inhibin A decreased. Now another test which we do usually is Corionic Villus sampling. How will you do it? You will first insert the needle into the placenta, of course ultrasonically guided. Then you will take up to 5 to 30 milligram of tissue. You will aspirate it and you will culture it, and it is usually done during 10 to 11 weeks. And why you have to do this, it is for genetic analysis from the DNA obtained from the cultured cells. Another investigation is amniocentesis. You are taking out the amniotic fluid, roughly 20 to 30 ml. It is not usually performed before 14 weeks because the amniotic fluid won't be there in sufficient amount and it might lead to abortion if you are not properly doing it. And what are the investigations you do in the amniotic fluid? You can look for the alpha fetoprotein, you can look for the acetylcholinesterases, and sometimes there will be sloughed off fetal cells in the amniotic fluid, which you can give for karyotyping. You can also do polymerase chain reaction and genotyping to rule out the genetic anomalies. So these are the investigations which you can do with the help of amniotic fluid. The next one is fetal blood sampling. So how will you do the fetal blood sampling? You are taking the blood from the umbilical cord, that is known as percutaneous umbilical cord blood sampling, PUBS. So it is usually done during 24 to 34 weeks. Here we take the blood for chromosomal analysis. Then another investigation is pre-implantation genetic diagnosis. This was once asked as a short note for UG as well as PG, I guess. So what do you mean by pre-implantation genetic diagnosis? You have the cells from the in vitro fertilization. You will take it, you will analyze it to detect the genetic abnormalities so that if it is genetically deformed, you need not implant it. So thereby you can prevent prevent the birth of a genetically abnormal individual. So that is the importance of pre-implantation genetic diagnosis. Then the other one is cardiotocography. It is usually done in third trimester to monitor the fetal well-being. So this is just a nutshell about the investigations which you do prenatally. Thank you. Thanks for watching.